Hi, my name is Dr. Kerry Tapuzian, and you're watching Ask Dr. T. Now, my specialty is anti-aging and functional medicine, and today's question is, what is an anti-aging and functional medicine doc? Well, let's try to answer that. First of all, the official definition is anti-aging medicine is the early detection, prevention, treatment, and reversal of age-related decline. Functional medicine is a science-based integrative approach that treats illness and promotes wellness by focusing on the biochemically unique aspects of each patient and then individually tailors treatment to restore balance, etc., etc., etc. I don't expect you to understand that. I do, of course, but really, to define it better, a functional medicine physician tries to predict and prevent disease before it happens, and we try to find the underlying cause of a problem. Okay, the root of a problem. We also use science-based medicine, and what that means is that, the medical textbooks that we had to read that are about 3 to 4 inches thick when we're in medical school, we use those as the different references for our treatments. Okay, we also, our specialty has a tendency to overlap a lot of other specialties. What does that mean? That means that we may normally treat a patient that would maybe go to an orthopedic surgeon or a rheumatologist or an internist or an allergist. Because of the way that we're looking to treat patients, we're able to treat a lot of different conditions, if you will. A lot of people, when they listen to me explain, what a functional medicine physician is, they say, "Oh, you're a holistic physician," or "Oh, you practice alternative medicine." And it's true, we are, but unfortunately sometimes there's a stigma that's related to those words holistic and alternative, and it really shouldn't be. A few other things too. We also utilize bioidentical or natural hormones in treatment. We also use pharmaceutical grade nutrients that we usually will obtain from compounding pharmacies, which are local apothecaries throughout the area. And we utilize new, old, and forgotten science-based treatment options. We use a lot of different specialty labs and testing. We use normal testing, but then we also do things like saliva testing, urine, stool testing, and hair analysis. What we are not is we are not a 5-minute visit, and we are not a here's your prescription visit. Also, we have several patients that will tell us things that other doctors have told them. And I've just quoted some of them down here. It's all in your head. All your lab tests are normal. There's nothing wrong with you. It's psychosomatic. Oh, you're just having panic attacks. The doctor put me on antidepressants. Okay, we are not that kind of physician. We try, again, to find the underlying cause of a problem. To continue, let's just talk about a few of the different types of conditions that we do treat. A lot of different hormone-related conditions, including menopause, perimenopause, andropause, which is male menopause, PMS, dysmenorrhea, which is painful bleeding. We also take care of migraines, infertility, sexual health. We take care of all the different autoimmune diseases, for example, rheumatoid arthritis, MS, Hashimoto's, lupus, Graves' disease, Crohn's disease, and then a wide variety of other problems, including prenatal health, children with problems with autism, ADHD, asthma, allergies, cancer prevention and treatment options, nutritional health, weight reduction. We also take care of different skin conditions, including psoriasis, alopecia, vitiligo, a lot of different chronic conditions that have fatigue, depression, and insomnia as some of the main complaints, fibromyalgia, chronic fatigue syndrome, different digestive problems, just to name a few. Now let's go through some different scenarios where we're looking at Western medicine, if you will, versus functional medicine. The first case we're going to look at here is a teenager that has a complaint of either acne, PMS, maybe they're not having periods or they're having painful or abnormal periods. Normally, unfortunately, what will happen is they'll go to their doctor and they'll get put on birth control pills, okay? In my opinion, birth control pills are for one thing, birth control, okay? And in this scenario, what a functional medicine doctor would do is try to figure out what's the underlying cause of these problems. Well, you take a teenager, they're on birth control pills, and in some situations, after about 4 to 6 months, they start getting depressed. And they go back to their family doctor or the doctor they were seeing, and they get put on an antidepressant, Prozac, Wellbutrin, Zoloft, etc. So now they're on birth control pills and an antidepressant. Well, with functional medicine, excuse me, functional medicine would say, look, these different symptoms could be from low thyroid function. So we would look to see if the patient actually had a thyroid issue and treat from that aspect. Because when you take a patient that has low thyroid and you put them on birth control pills, those synthetic estrogens will actually make the problem worse, hence the depression after being on the birth control pills. Plus, another problem is that birth control pills will lower testosterone levels. And in women, testosterone gives you a sense of well-being. So, sense of well-being, depression, same thing. Let's go to the next case, which is talking about prostate enlargement, or BPH, as it's sometimes called. Western medicine will do certain lab works, and chances are they'll treat you with a medication like Proscar. What functional medicine will do is a little similar. We'll check certain blood tests, but we'll also check different hormone levels, including estrogens. Men make estrogens. And that is the root or underlying cause, for the most part, of enlarged prostate. So the goal is to try to get those estrogens out of the body, and that can be done by taking certain supplements, including zinc. Turn the page here. The next situation would be treating menopause. In Western medicine, they usually treat the symptoms. For example, if you're experiencing insomnia, they'll put you on a sleeper like Ambien or Lunesta. If you're having hot flashes, they may use Effexor, Cymbalta, or Zoloft, which are antidepressants. If libido is a problem, they'll put you on Wellbutrin or Estratest. Wellbutrin is another antidepressant. Estratest is a synthetic testosterone, which is, by the way, outlawed in Europe because it can cause liver cancer, but readily available in this country. Vaginal dryness, Premarin cream. And if you don't know, Premarin stands for pregnant mare urine. Depression, again, Effexor, Cymbalta, Zoloft, antidepressants. Functional medicine physician, what they basically do is they'll do hormone levels, either through saliva, urine, or blood, to see what levels are low, and then using bioidentical or natural hormones, will replace those hormones that are low to fix the underlying cause. Now, what's the big deal with bioidentical or natural hormones versus synthetic hormones? Well, just look at this picture down here. This top one is natural progesterone. This is what it looks like when your body makes it. This is what bioidentical hormones look like. This one down here is Provera, a synthetic hormone. And in red, you can see that it's been tweaked a little bit. Still kind of looks the same, but yet it's still different. Well, what's the big deal with tweaking a compound like that? If you look over here, I'm going to show you two compounds, which look pretty similar, both of them together. But the first one's estrogen, and the second one's testosterone. Big difference. Small changes, big difference. Same thing happens with the synthetics. Last but not least, autoimmune diseases. Depending on the disease, rheumatoid arthritis, multiple sclerosis, there are different pharmaceutical agents that are available for a Western medicine doctor to prescribe. For rheumatoid arthritis, Imuran, Cytoxan, cortisone, MS, interferon, Copaxone, lupus, Plaquenil, which is an anti-malarial drug, and the list goes on. For a functional medicine physician, again, what's the underlying cause? And what we try to look at is what are some of the theories that cause autoimmunity? One of them is called genetic mimicry, where there's some type of bug, microbe, or a food antigen, allergy, that looks really similar to another part of your body. So your immune system attacks it, but then what happens is now it's been programmed to attack things that look like that as well, and it starts attacking another part of your body. Treatment is basically to boost up your immune system, remove these antigens or allergies so that this autoimmune situation will go away. And another theory that's out there is that anything that will damage tissue or protein in your body, your immune system all of a sudden says, hey, I don't recognize you anymore, and it starts killing it. Okay? I'm going to give you one example with diet, because diet is really important with autoimmune diseases too. Because sugar, when you have too much sugar in your system or in your diet, it actually will damage protein. An example is when you bake a loaf of bread. And the crust of the bread, what happens is it gets brown like that because the sugars that are in the flour mix with the protein, and it's called glycation. Okay? Same thing happens in your body. And to finish it off, Arthur Schopenhauer, a philosopher in Austria was born in 1788, he said that all truth passes through 3 stages. First, it is ridiculed. Second, it is violently opposed. And third, it is accepted as being self-evident. Any questions out there? There's a question. Well, you can email me at askdrt@gmail.com, or you can go to our website at www.cfhll.com. My name's Dr. Kerry Topouzian, and you've been watching Ask Dr.